will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to my colleague, Dr. Erica Wheeler. Dr. Wheeler is one of these unsung heroes behind the scenes, helping Trinidad and Tobago and the Americas with its COVID response. Welcome, I think, to the first time on this press conference. Also with us is the Chief Medical Officer. Ladies and gentlemen, I want to share with Dr. Wheeler's permission, which I sought earlier, some information from a brief that we received from PAHO that came to my desk this morning. The sharing of this information from this brief is to alert the Trinidad and Tobago public that COVID-19, as it affects the Americas of which we are a part, is not over. I will share some excerpts now from this brief, and I quote, PAHO is deeply concerned with how rapidly the pandemic is expanding. It took our region, that is the Americas, 3 months to reach 1 million cases. That's for the Americas. 3 months to reach 1 million cases. 3 months is what, 12 weeks? Yeah, 4 weeks are 12. But less than 3 weeks to nearly double that number. So 1 million cases, 3 months, 3 weeks to double to 2 million. As of June 15th this year, there has been more than 3.8 million cases and almost 203,600 deaths in the Americas from COVID-19. Goes on to say we are fast approaching in the Americas 4 million cases. The warning contained in this brief goes as follows. We are not seeing transmission slowing down. That is the case in almost all countries in Latin America with whom we trade, with whom we have air travel with, and some in the Caribbean. In the Americas, the COVID-19 pandemic is a regional problem, not a country problem. Ladies and gentlemen, this is where we are in the Americas region. We have been saying from these news briefings over the past couple of weeks that the daily increases in COVID-19 cases globally was in the vicinity between 100,000 to 150,000 new cases per day. Just last week we recorded, since this pandemic started, I think almost 200,000, Dr. Wheeler?
Cases, yeah.
Somewhere?
Yes.
The highest daily increase ever. The daily average for new cases has now moved from between 100 to 150,000 to 150,000 plus. The pandemic is not slowing down. Where are we now globally? At the press conference in Tobago, I indicated, do not be surprised if when we come back to Trinidad for this press conference today, we will touch 9 million cases. We are now at 9,084,144. It is a promise which I wish I didn't have to keep. Out of that, 471,333 people have in fact died, and of which, of the 9 million plus, 57,844 are in serious or critical condition. Let us hope that by next week, when we come back here by next week, Wednesday, we do not talk about the grim reality of 10 million cases, because at the current rate of increase between 150,000 to 200,000 cases, we will in fact touch 10 million cases by next week, Wednesday. Last Wednesday and Saturday in Tobago, we started the conversation on two topics. One, the number of contacts spawned in New Zealand after 2 sisters were granted compassionate leave to leave quarantine facilities. I again want to correct the statement made last week, Wednesday. They did not spawn 320 cases. What they spawned were 320 contacts. But New Zealand is trying to find out now as I said on Saturday in Tobago, how many of those contacts will in fact give them positive cases. But the point is, asking to leave quarantine early is in fact a dangerous precedent to set. The other issue which we started to raise last week, Wednesday and Saturday, was the information coming out of China where Beijing had to go into another lockdown because of the discovery of a 137-person cluster of new coronavirus cases, which the international media dubbed the European strain. And I did indicate that I will ask an expert to come, and that is the reason for Dr. Erica Wheeler being here this morning, who will give us PAHO's perspective on this new strain, whether it's in fact it is a new strain, what level of concern should we have, should we be worried, should we not be worried. So she will be able to go through that with you, and I urge you to take the opportunity to ask her any question on COVID in the Americas, because we are part of the Americas region. We have diplomatic ties, we have trade ties. Panama is the gateway between Trinidad and Tobago and Central and Latin America and South America. So that's a very important air hub. So with that update this morning, and with the promise to have Dr. Erica Wheeler, I want to thank Minister Cox for the past few minutes, and over to you. Thank you.
Thank you very much, Minister. The Chief Medical Officer, Dr. Roshan Parasram, will now provide us with a clinical update. Dr. Parasram.
Thank you, Minister Cox. Good morning, Honorable Ministers, Dr. Wheeler from PAHO, members of the media, members of the viewing and listening public. The clinical update for the 22nd of the 6th, 2020 is as follows. For number of samples submitted, 4,313. Number of unique patient tests completed thus far, 3,759. Number of repeated tests, 554. Number of positives remain at 123. The number of discharges remain at 109. Total number of deaths for Trinidad and Tobago are at 8. Total number of hospitalized patients at present remain at 6 at the Cora facility. With regards to our parallel system, we now house 619 persons throughout the system. At the UWI Penal Campus, there are 71 persons being housed there. The Chancellor Hotel houses 22. At the Tacarigua facility, we have none. In the Napa facility, we have 18 individuals, as you know, who are healthcare workers. At the Home of Football, there are 8 individuals being housed. At the Sandy Grande facility, there are 24. On the Enchantment of the Sea, we remain with 295 individuals. The UWI Canada Hall, where we have the repatriated Jamaican students, we have 99 persons. UWI Freedom Hall, there are 46 individuals. At the Cape Park Hotel, 48. There are no persons at the Cascadia Hotel at this time. And as I said, there are 6 persons in the Cora facility who are positive cases. Just to correct one piece of information, in the UWI St. Augustine campus, the total capacity is 71. The current utilization is 50 individuals. Thank you, Minister Cox.
Thank you very much, Dr. Parasram. Dr. Erica Wheeler, PAHO WHO representative for Trinidad and Tobago and the Dutch Kingdom Islands, will provide the WHO and PAHO perspective of the COVID-19 pandemic. Dr. Wheeler.
Thank you, Minister Cox. Good morning to you. Good morning to the Honorable Minister of Health. Good morning also to the media and the viewing and listening public. As indicated by the Honorable Minister of Health, I will just give you an update on what the situation is from the WHO and PAHO perspective. So on the 19th of June, the WHO technical lead for health emergencies said at a press conference that the genetic sequences from Beijing, that food market in Beijing, had identified this virus as a European strain. Now, this COVID-19 virus, of which we have often been speaking, I want to assure you, the listening and viewing public and everyone, this is not a mutation. This is not something out of the ordinary. Viruses changed a little over time, but we do know that there are more than 40,000 full genome sequences of the COVID-19 virus, the SARS-CoV virus, that are uploaded to publicly available websites. And there are a large number of scientists, virologists, and professionals who are looking at the sequences very frequently. So we can assure you that this is not a mutation. We also know that strains and viruses have moved around the world, and the fact that the virus from Europe sparked China's latest outbreak, it doesn't mean that the virus originated there. Most likely, the disease was imported from outside of Beijing at some point in time. And what is happening now is that we know that there are little differences in the virus, as I mentioned. For example, we know that the COVID-19 virus has been relatively stable. And in terms of the way it is transmitted, we know that in terms of the type of disease SARS-CoV causes has not changed in severity either. So there is no need to be overly concerned. In Beijing itself, they recognized that there were an increasing number of changes. So what they did was they actually upgraded their emergency response from level 3 to level 2. And this was effective from even the 16th of June. And the government there identified that the situation needed a response, and they actually instituted, according to our office in Beijing, a number of measures to restrict the spread of what was identified as this European strain. Bearing in mind, as I said, it doesn't necessarily mean it came in from Europe, and there is still monitoring being done to find out about the chain of transmission. So they have instituted restrictive protocols and health monitoring in residential communities. They've been doing temperature checks there and verification. They've been doing instituting cross-city travel restrictions. They have containment measures for high-risk persons, such as fever patients. They've got containment measures in place in health and medical institutions, and they have instituted hospital prevention, for hospital-acquired infection. They have got containment measures at farm produce markets, because we know it was identified in a market where fish and meats were being sold. So they've instituted containment measures at the farm produce markets, at restaurants, canteens, and also strict accountability at local authorities and line departments and in all employment agencies in that area. So good personal hygiene has also, as we have been repeating in Trinidad, good personal hygiene as well as the distancing, the physical distancing has been reinstituted. So they, bearing in mind what previously happened, they are taking measures, therefore, to contain the virus. But I also wanted to pick up on something else that the minister had said in terms of the Americas, if you would permit me, Mr. Minister. Although there was this outbreak identified, correctly so, and yes, we would have concerns because of what previously happened, I want to draw your attention to what the minister mentioned coming out of PAHO, that we do have still an exponential growth of COVID-19 in the Americas, about which we do need to be concerned. I just want to give you a few figures. If we look at the 15th, between the 15th of June and the 21st of June, we would see, for example, in the USA, on the 15th of June, there were 25,314 cases. But at the 21st of June, these are new confirmed cases, excuse me, not cumulative, but new. But on the 21st of June, the new cases had gone up to 36,617. In Brazil, similarly, there was a vast increase from 21,704 new confirmed cases in Brazil on the 15th of June to now 54,771. In that same period, on the 15th of June, China did have 49 cases, and as of the 21st of June, because of the measures they took, they now have 27 cases. So this virus is here with us. So we do need to actually be mindful and continue to institute all our public health and social measures that we have been discussing so far. So that is just my brief update. I want to say there is no mutation in the virus. Yes, it was identified as a European strain, but that does not mean that it arrived recently from Europe, because this virus has been circulating in the world, and they are investigating the current chain of transmission. Thank you, Minister Cox.
Thank you. Thank you very much. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 98.1.
And a very good Monday morning to the panel. Stephen Cummings, 98.1 FM. 2 questions, one for Minister Dayal Singh and the other for Dr. Wheeler. Start with Dr. Wheeler. Dr. Wheeler, it's being said that the rate of spread of the virus is accelerating, especially in the Americas, of which we are a part. How real or likely is a second wave of the virus in the Trinidad and Tobago context? We can't keep our borders closed indefinitely. And Minister Dayal Singh, now that we have moved to a higher level of economic activity in Trinidad and Tobago with the further lifting of restrictions, I'm not sure if I missed it. Is there anywhere in the regulations that speaks specifically to the movement of import and export of goods and services? Are members of the business community, for example, free to engage in, let's say, wide-scale imports, knowing that there is a threat by some countries from where these goods may be traded? Thank you.
Okay, so let me take the second question first. Even when we started our public health measures with the first set of regulations way back when, we never stopped the importation or export of essential goods, you will remember. Even cars were coming in. Pharmaceuticals, foodstuffs were allowed free entry. The risk of importing the virus, and the Chief Medical Officer will come in here, through imported goods, example meats, is something that we have shared responsibility with the Ministry of Trade and Industry for granting licenses, the Ministry of Health under the Chemistry, Food and Drugs Division, and also the Ministry of Agriculture. So you have 3 ministries with public health experts and the Ministry of Health to ensure that the threat of importing coronavirus through imported goods, especially food and pharmaceuticals, is minimal. But the Chief Medical Officer can speak to those measures in some more detail before we go on to Dr. Wheeler.
Dr. Parasram?
Yeah, so Mr. Cummings, I think the Minister would have underscored the importance of intersectoral collaboration as it relates to ensuring that anything that is imported through the borders we have close eyes on all of it. So the Ministry of Agriculture will be responsible for certain aspects of it. Through the Food and Drug Division, there's a Food Advisory Committee which will regulate the nature of foodstuff that are brought into the country, as well as the way inspections are handled. There's a single electronic window which is monitored through the Ministry of Trade, that all agencies will get information on importations in a real-time way, and they all have full visibility and they can approve or not approve based on what they find on the website. So there's collaboration throughout, intersectoral, and we have ensured since the beginning and even prior to this epidemic that the foodstuffs coming into the country go through a rigorous public health look before they're allowed to come in.
Thank you. Dr. Wheeler.
Okay, so thank you for the question. How real is a second wave? Well, as long as we keep our borders closed, there is little danger of someone coming into the country and bringing in COVID-19. But of course, I think behind your question, one would understand that once the borders are open, there is always that risk, especially since we have just said that in the region of the Americas, we are seeing an acceleration of COVID-19. The issue really then becomes, how well is your health system able to cope? What measures are you going to put in place in terms of persons coming into the country? So it is true that no country can keep its borders closed forever, but it is also true that a country needs to gauge the strength of its health system and the ability to cope with an influx of persons, some of whom may very well have COVID-19.
Wow. We now call on AZP News.
Hi, good morning. Priya Bihari, azpnews.com.
Morning,
Dr.
Priya.
Wheeler, can you tell us how many strains we have in the Caribbean and Americas, and would these new strains affect the development of the vaccine? Under the CMO, can you tell us if the contact tracing has been done for the 6 active cases we have now, and where you think they have contracted it?
All right, we'll ask the CMO to answer first, please.
Okay, so in terms of the 6 active cases that you would recall, those are persons that would have been on enchantment of the sea. When they first came in last week, Friday before, we would have done a PCR test on all members, 308. Of those, we picked up initially 6 positive individuals. Those individuals were immediately brought off the vessel into Cora, where they remain. So in terms of contact tracing, the only contact tracing that would have taken place after that was the contact tracing on the vessel itself, where the remaining 295 persons are housed, to see if there would have been any sort of contact between those individuals and other individuals who remain on the vessel. So that does not impact our contact tracing on land. As you know, those people were on the ship. So that is our contact tracing would remain on the individuals in the ship, and they would be risk stratified based on their contact with the positives.
And also, if I may come in here prior, that is why we took the unpopular decision to limit movement on the ship. It is for the health and well-being of those same persons who are coming to the media to complain that they are being restricted. If we restrict them, isolate them, they will come off the ship faster, right? Because that was a COVID positive environment. So I hope the public sees the wisdom in not allowing those persons aboard the ship free reign of the ship. Thank you.
Thank you. Dr. Wheeler.
Thank you, Minister Cox. I did mention that there were 40,000 genome sequences. In the Caribbean, I will have to get back to you on what exists in the Caribbean, because I don't have that at my fingertips. But I can assure you that there are many labs that are attempting to develop vaccines, and this will not prevent the development of a vaccine. And as you can imagine, there are many labs also competing to be the first to develop a vaccine. But I will make further inquiries about the Caribbean and get back to you.
So I could shed some light on the Caribbean perspective. The Ministry of Health of Trinidad and Tobago has in fact started discussions with Professor Christine Carrington, who I think the media knows well by now, the genetic virologist at UWI. And we hopefully will be partnering with UWI to set up a lab in Trinidad and Tobago to do just that, to see what are the different strains of the virus circulating not only in Trinidad and Tobago, but we'll be using samples from across the Caribbean region. So we started that discussion with Professor Carrington last week, Saturday, I believe. And when I go back to the office this afternoon, I hope to deepen that conversation so that we could do exactly what you were suggesting prior. Okay? Thank you.
Thank you. We move to Newsday.
Hi, good morning. Clint Chantak of Newsday. How are you?
Morning, Clint.
Hello, you hearing me?
Yes.
Yes, we are hearing you. We are hearing you. Go ahead.
Hello?
Yes, go ahead.
Hello? Are you hearing me at all?
Yes, we are hearing you. Are you hearing us?
Okay, great. Thank you. Okay, me again. I just wanted to ask two questions. First off, I wanted to ask, well, seeing that we are going ahead with our reopening and we are essentially now exposing ourselves to situations where you could have potential spreads with all the different areas being opened, I wanted to get a sense as to where are we at with the level of testing for COVID-19? Do we still have people who are coming forward to get tested? We still have the random testing going on. And secondly, I wanted to ask Dr. Wheeler if she could clarify a statement that was made recently by a Dr. Maria Van Kerkhove of WHO, who said that the risk of asymptomatic spread of COVID is pretty low, and we should be focusing more on symptomatic spread. So is that actually something that we are doing or not doing, as a country, as a region? Could you clarify whether that statement is actually we want to speak to the validity of the statement?
Okay. So thanks, Clint. I will take part of the first question, then I hand over to CMO for the technical bit, and then we go to Dr. Wheeler. I had asked TTT to queue up the new normal poster because, Clint, your question is a very valid one. So if we could queue up the information I had asked for. As we open up the economy more and more, it is not only a matter of increased testing. Yes, testing will continue. Yes, all the community testing will continue. We have never stopped it. What is important, Clint, and members of the media and the public, is this. I have said that the baton has now been passed to the population as we open up. That is what that poster speaks to. It speaks to the responsibility of the average citizen, store owner, mall owner, doubles vendor, gyros vendor, NLCB operator, all of that. What does it speak to? Wear a mask when you go out in public. Wear a mask. You are starting to see the incidence of mask wearing, where you cover your nose and mouth like this, coming down. Leave the poster up, please, if you can. Second, keep a safe distance when you are out in public. 6 feet. If you are ill, stay home. Wash your hands and use hand sanitizers as frequently as humanly possible. Cough into a tissue which you dispose of, not a handkerchief which you then put into your pocket. And don't do like me, because I am guilty of it, as you see, touching your face. Don't touch your face, and clean and sanitize surfaces. If we practice these 6 or 7 public health measures, which are inexpensive, not terribly inconvenient, we will avoid a lot of pain and suffering. And as we open up the economy, any area or sphere of activity, like in public transport, whether it's a CAL plane taking you to Tobago, a taxi or a maxi taxi, where you can't social distance, what you can then do is to make sure you have a mask, make sure you sanitize. It is situation specific. So we are asking the population to adhere to these 6 or 7 simple measures. Not terribly inconvenient. Masks are very cheap. That will save you and save your loved ones. I don't know if the CMO wants to come in now.
So just in terms of the update on the labs itself and our ability to test as a country, you would have noted that Tobago received their test kits as well as their machine. The machine was received prior to the test kits over the weekend. Tomorrow we are sending a team just to continue and finalize the training with Tobago so that we can have that up and running in the quickest period of time. As it relates to the Trinidad Public Health Lab, so as you know, the Caribbean Public Health Agency, which shares a property with the Trinidad Public Health Lab, have been testing for the Caribbean region for quite a while. In addition to the Caribbean Public Health Agency, we would have gotten another PCR machine from the IAEA, which came in last week, and that will be placed at the Trinidad Public Health Lab, which is run by the Ministry of Health personnel. They would be trained as well by the Caribbean Public Health Agency, and we will try to have that site up and running within the shortest period of time. We continue to have the UE site, so we are building our capacity with our testing as the days go forward, and we want to ramp up our community testing as we expect as more and more people begin to move. We expect that our viral, as I had shown 2 weeks ago, there was a dip in the number of viral cases. As more people begin to move and interact, we expect not COVID-19, but we expect all viral illness to go up slightly. Once those people start to come into our facilities, we will increase our testing to try to pick up if there is any spread of any other diseases as well. As you know, with regards to the respiratory pathogens, we are capable of testing up to 15 different viruses to see what we have circulating in the population, and we'll be doing so over the next couple of weeks.
Thank you. Dr. Wheeler, I think there's a question.
Yes, so the question was on whether I can confirm the statement made by the WHO Technical Lead for Health Emergencies, Dr. Maria Van Kerkhove. Certainly, I would never second guess the technical lead. You have to understand that WHO has a plethora of scientists and researchers across the world that collaborate, and we are studying constantly COVID-19. We only became aware of it in December, and we are in June. So yes, there has been some evidence of persons who are asymptomatic, but as she mentioned, we should be focusing on those who have symptoms, and we should be doing what the Director General said when he said test, 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 which means test those persons who've been identified, test their contacts, trace their contacts and test them. And here in Trinidad, we're also doing as community-based testing, as the CMO just clearly pointed out. So it is those persons who are COVID-19 positive and who are in danger of spreading the disease to one or more persons that we need to be more concerned about, because we cannot at this point in time identify precisely globally what percentage of any population is asymptomatic. Thank you.
Thank you. We move to TV6.
Morning, Minister, CMO, Dr. Urvashi from TV.
Morning.
Minister Diyal Singh, yes. So my questions.
I think
to ask about TNT citizens abroad. The Prime Minister briefly spoke about it on Saturday. So I want to ask, when will more quarantine spaces be available, and how many can be made available? And two, what is the envisioned procedure? Is there an envisioned procedure for repatriation?
Okay. So, Urvashi, we have said, and I welcome the opportunity to reiterate, the repatriation of citizens to Trinidad and Tobago is not only dependent on the number of quarantine beds. There are other limiting factors. So in other words, if you have requests for 10,000 persons to come back, it doesn't mean that you build out 10,000 quarantine spaces and bring them back. The limiting factors are, one, hospital capacity. Prior to COVID, we have 3,000 beds in the public hospital system. If we brought back, theoretically, 10,000 persons, because we have 10,000 quarantine beds, and 50% turn positive, which is 5,000, where do we put them? It means the entire health system of 3. It means we'll have to send home everybody in all the hospitals and only dedicate Port of Spain, San Fernando, Arima, San Grande, everywhere, St. Anne's, to only treating COVID-positive patients, Urvashi. So I welcome the opportunity to once again say, from a health perspective, the limiting factor is not only the number of quarantine spaces. It is the ability of your overall health system to cope with the conversion of negative persons into positive persons. So I hope that answers your question. It means you must expand significantly your HDU capacity, your ICU capacity. You have to double the amount of health personnel. So I welcome the opportunity to say once again, the repatriation of citizens into Trinidad and Tobago is not only dependent on the number of quarantine beds. There are other limiting factors. Bed space in case 50% turn positive. So just give you the example again. If we do as being suggested and allow 10,000 persons to come in and 50% turn positive, that is 5,000, prior to COVID and even now, we don't have more than 3,500 bed spaces. Where are we going to put them? That is why the bringing back of nationals has to be done in a coordinated fashion with the Ministry of National Security, based on his assessment of who needs to come in. He communicates with us to find out how many quarantine spaces we have. That is how it is done. So I hope that answers your question again, Urvashi. Thank you.
Thank you, Minister. Astronaut Health News.
Gwyneth Stewart, Astronaut Health News. Good morning, everyone.
Good morning.
Dr. Wheeler, am I correct in saying that WHO no longer deems it necessary for asymptomatic persons to wear masks? And if not, what's the scientific reason for this? And Minister Cox, can you say how many persons are still outstanding to receive COVID-19 salary relief grants, and when are they expected to receive them?
Dr. Wheeler?
Okay, so thank you for that question. I think what WHO has said, it has put out guidelines about who should wear masks, what types of masks. It said very clearly, what we've said is that masks, N95 masks, surgical masks should be kept for health professionals. WHO has also recognized that in some countries, and according to what the government determines, that its population may wear, as in Trinidad and Tobago, wear cloth masks. So WHO is not prescriptive. It cannot tell governments what to do. It can put out technical advice about who should wear a mask, in addition to health workers being the ones that wear the N95 mask and the surgical mask. We've also advised that persons looking after individuals in the community who are ill, that those caregivers also wear masks. We've also said, for example, if pregnant women who've been diagnosed as COVID-19 positive, that when they breastfeed, they wear masks as well. So the issue of WHO saying categorically that asymptomatic people should not wear masks, I think there has been room in its most recent documents to say that there are conditions under which persons in the community can wear masks. We give technical advice, we give guidance, but governments are the ones that determine for their citizens what is best. Thank you.
Thank you very much, Gwyneth. I'm advised that the Ministry of Finance has paid over 25,000 salary relief grants to date. The Ministry of Social Development and Family Services has paid over 20,000 income support grants. I don't have the details as to how soon. I know that they have been working every day and distributing grants daily. On Wednesday, I will try to give a more comprehensive update when I receive the information. Express?
Good morning. Kim Boodram from the Express.
Hi, morning,
Ministers. Morning, Ministers, Doctor. Minister Dayal Singh, if this is something you can address, one of the things coming to us is that the rainy season is underway. The CMO did mention earlier that there would be an expected increase in viral load overall. But we're getting a lot of communities complaining that maybe also due to the lockdown and restrictions, they're not getting the regional corporations in their area at all in the last few weeks to months, and that a lot of communities now are actually just overrun with some vermin, and also mosquitoes. Quite a few communities in Central are saying it's unbearable. I know this is would also be a local government issue, but if there's any connection to health that you may have had a conversation recently about how that type of work is going as the rainy season gets heavy. Mm-hmm. Thanks.
So there's some joint responsibility between the Ministry of Health and the Ministry of Rural Development and Local Government. So I know the Chief Medical Officer is more in tune as to what are the joint responsibilities, and he can speak to that.
Dr. Parasram?
Okay, so as it relates to vector-borne diseases, they are split into two broad categories. So there are insect vector-borne diseases, which fall under the remit of both the city and regional corporations and the Insect Vector Control Division of the Ministry of Health. There are other vector-borne diseases like rodent-borne diseases, for example, leptospirosis, which in terms of the response, baiting, etc., is under the control of the local government arm, however, with some collaboration through the offices of the CMOH. As it relates to mosquito-borne diseases, the ministry has started with its dengue drive a couple of weeks ago, and we remind the population that the most important weapon against the fight against mosquito-borne diseases is keeping your environment as clean as possible. So as little as a tablespoon of water can breed mosquitoes, and we have to be cognizant that we have personal responsibility to take, as we have said for many years, with regards to making sure an environment is not only clean by way of cutting your grass, but making sure there are no receptacles that will breed mosquitoes and therefore cause a resurgence in mosquito-borne disease. The onus of spraying is not an answer that will, what we do in terms of spraying is two types of spraying. Indoor residual spraying, which is applied to the houses on the inside, which gives you about 2 to 3 months protection on the inside of your home. There are adulticiding, which kills the adult mosquito, but it only lasts for a couple of weeks if they're the larvae and pupal form in breeding habitats around your home. So the most important weapon remains your ability to clean your environment and have that personal responsibility so there's no breeding sites around your home.
Kim, let me just decorate and embellish what the Chief Medical Officer has said, because I am always taken aback when the questions come about mosquitoes and rats. What is the government doing? As the Chief Medical Officer has just said, it's a shared responsibility. You can spray all you want, but if homeowners insist on having flower pots with their saucers with water, no amount of spraying is going to touch that. If homeowners do not clean their guttering, no amount of spraying is going to help that. If homeowners do not do the simple things and cover their water tanks with a mesh, no amount of spraying can do that. If we carelessly discard garbage, which encourages rats, the answer is it is a shared responsibility between the state, local government, and most importantly, the homeowner. Because when you walk around homes and you see pools of water gathering in discarded water bottles, discarded flower saucers, flower pots, that is a major source of mosquito infestation. So the message is for the average citizen to work with the government. We will do our part, but you also have to do your part to keep your immediate surroundings free from building homes and houses for mosquitoes and rodents. Thank you.
Thank you. Loop Titi.
Hi, good morning, everyone. Nika Parsonal here from Loop.
Good morning.
Minister Dayal Singh, in light of the COVID-19 restrictions seeing a further ease, particularly as it relates to the public service returning to 100% capacity, I'm just wondering if you can reiterate some of the measures slated for workplace environment policies as it relates to mask wearing and distancing. I've heard a few complaints that regulations aren't being adhered to, and with a further influx of employees, I guess the clarification is just needed for managers to pay attention.
Okay. So as the Honorable Prime Minister said on Saturday, the issue of the public service and the measures will be the responsibility driven by the Permanent Secretary in the Office of the Prime Minister and all other permanent secretaries, because each ministry will have different physical layouts and so on. So we have developed guidelines which we have given out. The Chief Medical Officer can speak to it in particular, but that process for the public service is to be driven by the permanent secretaries and driven ultimately by the permanent secretary in the in the Office of the Prime Minister.
Dr. Prasram?
So again, it goes back to the new normal, and Minister would have gone through in detail what the new normal, the 7 steps for the new normal. But as it relates to workplaces, we have been working with all the ministries and some of the PSAs as it relates to creating that social distance, where social distance cannot be had. In a meeting, for instance, we advise using masks. The importance of sanitizing frequently touched surfaces is extremely important and cannot be underscored. However, the most important, as I have said before, is that we need to stay at home if you are ill. If we stay out of a workplace when you are ill, we don't bring the virus into that space, and we decrease the risk of potential spread in those spaces. So those are the key components that we will be looking at as it relates to restructuring and reorienting the workplace. The use of partitioning is being used heavily by some of the ministries to ensure that you have that designated space between individuals during their normal work day.
Thank you. Guardian Media Limited.
Hi, good morning, everyone. Josh Christenondo.
Morning.
Yes, I have 2 questions. Firstly, what is the complement of public health inspectors currently hired by the ministry to carry out inspections, given what has taken place recently with the opening of, well, the majority of businesses? And secondly, as it relates to wedding receptions limited to the 25 people limit outside of a church setting, as is, of course.
Okay, thank you. Dr. Prasram?
So I can get the number of public health inspectors. So the public health inspectors are actually shared between, the Ministry of Health has public health inspectors under the Chief Public Health Inspector's Office, and every regional corporation in the country, of which there are 14, they have their own group of public health inspectors that start with a chief in each area and goes down into different levels. So the group of individuals we have is quite large, and I think they can actively police what is going on in terms of reopening, and they have been doing so for many years. In terms of your second question, and it goes back to the definition of a public space. So public space is defined in a number of legislations. We would have noted anti-smoking legislation as well, most recently, as well as public health regulations. And the public space is defined as indoor or outdoor area, whether privately or publicly owned, to which the public have access by right or by invitation. And this is the exception, but not a place when used exclusively by one or more individuals for a private gathering or other purpose. And this is where weddings, etc., receptions will fall into that exceptional circumstance. So if you're having your function in the church, of course, we go back to the places of worship guidelines. But once you go into a privately owned function place or rented place, that is for a private function wherein you have no access to any but other individuals, Those as an exception to a public space will be defined by your own guidelines, and we expect that some level of conformity with the national guidelines occurs within those spaces to prevent spread, but it is something that should be self-regulated.
Okay, thank you. We go back to Newsday. One question, please. Is Newsday on? Let me move to TV6, please. One question. I'm seeing TV6 hands up.
Hi, morning again. Urvashi from TV6. Minister, I'm seeing online here on Facebook, there have been political activities over the weekend, and I'm seeing persons not in compliance. You're not seeing people actually hugging up. There's no physical distancing, wearing of masks. Is there any action that can be taken against these persons?
That's a difficult one. We have guidelines. We are advising persons to stick with guidelines. Look, I myself find myself at times forgetting the guidelines, but when I go out, I wear a shield now, a plastic shield instead of a mask, which is more effective. That prevents me from breathing or passing droplets to anybody, and prevents anybody from getting to me with droplets. But we ask all persons, myself included, all candidates, to try as far as possible to heed the guidelines. I found myself in the, whether you call it unfortunate or fortunate position yesterday, doing a walk where two women rushed up and hugged me. I mean, I didn't invite them to do it, but if that was caught on camera, it will look bad. But they rushed up, one from the back, which I didn't see. So, you're going to get these things happening from time to time, but let's try as far as humanly possible to adhere to the 7 guidelines which we have put out.
Okay, we go back to ACP News. One question, please.
Sure. Hi. Good morning. Good morning again, Dr. Wheeler. Trinidad and Tobago has a population of 1.4 million. We have only had 123 confirmed cases and sadly 8 deaths. You said that the Americas, there continues to be an exponential increase in COVID-19. Certainly, we are doing something right. Can you maybe say what you think we are doing right and what lessons the other countries in Americas could learn from us?
Okay, thank you for that question. What we're doing right here has been the continuation of the testing when someone has been identified as having COVID-19. So ensuring there are enough tests, ensuring therefore also that there is contact tracing, extensive contact tracing. So having enough contact tracers to actually go out in the community, find where persons are, identify them, and also test them. What we've also been doing is instituting all of the public health measures that WHO and PAHO have suggested, which we keep repeating, but it is necessary because it's not common for people to do, but observing the physical distancing, the cough etiquette, the hygiene, ensuring also too that there is a system whereby you can house people who've been identified as suspected cases, but also having the capacity in the health system to treat those who have been identified as having COVID-19. So it is an issue of detecting, tracing, treating, isolating, quarantining, all of those things together, because if you do one and not the others, and of course the personal hygiene and keeping your environment clean, your surfaces and so on, the hand washing and using hand sanitizers. So it's actually a combination of all of those different things, because you have to have your health system that's prepared and equipped, and your health workers who are competent enough to treat those who have been diagnosed and who are in hospital. And then you also have to have facilities where you can observe people who have been identified as being in contact with someone who contracted COVID-19. So vigorous and rigorous contact tracing is a critical part of it. And also in our case, we are island states. So we do have the capacity to determine who comes into the country. And very early on, there was a determination that certain countries, it was not safe to have persons coming in. So we did eventually also close our borders. So it is a combination of all of these different things. If you live in a country where your borders are extremely porous, you're part of a mainland, it is difficult to stop persons crossing in and out of your country, but with island states, you can have more control about who enters into the country. So you actually exercise better control. And in the case of Trinidad, bringing back persons in such a way that they know that the health system would not be overwhelmed has been something that has also protected us. So I would like us to think of it as a package of measures that have been instituted early on in order to what we have so often called flatten the curve. Because once you have it in your country, the most important thing is that you are able to control the spread, and you can do that through the measures that I've just mentioned, together with having the facilities to treat those who have been identified as having COVID-19. Thank you.
Thank you very much, Dr. Wheeler. Before we close, I have a question for the CMO. Please help in clarifying for us parents. Team sports, as it relates to children, was previously stated as commencing September the 1st. And the person wants to know if this has changed. Also, can this be properly communicated and a distinction made between adults and children? I believe it has to do with the fact that team sports has resumed, and they would like to know if children team sports is part of this. Dr. Parasaram.
So basically, when we speak about team sports, we speak about children as being different. So children were always treated differently in the grand scheme of things for the main reason, and we have said this over and over again, that children are not able to follow the measures that we have put out as stringently as adults do. And as we have seen, and Minister alluded to, even adults find it difficult at this time to have social distancing, etc. So we want to protect our children as best as we can, and the only way we can do it at this point is to keep them apart, unfortunately. So we are asking that until September 1st, when we are looking towards reopening school and school-related activities, if nothing has changed, that we continue to use this as a sort of milestone for all child-related events, so that we protect our children for as far as humanly possible. Once we get children together, and the data we have retrospectively would speak to viral illnesses as soon as we open schools. Whether we open it in the Easter term, we open it in September, every year there's a spike in viral illnesses, and that occurs because of congregation of children. They're not able to properly social distance. They meet and greet each other in different ways. The spread of viruses occurs quite quickly in those environments, and then we take it back home and it spreads throughout the population. So once children begin to congregate, we lose the ability to maintain the public health measures which we have tried so hard to inculcate into the minds of everyone.
Thank you very much, Dr. Parasaram. Thank you, Minister Dayal Singh, Dr. Wheeler, members of the media, members of our viewing and listening audiences. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Today begins Phase 5 of the reopening of Trinidad and Tobago, as announced on Saturday by the Prime Minister, Dr. the Honorable Keith Rowley. And this means in-house dining at restaurants resumed. Today, bars, cinemas, theaters, casinos, and members' clubs will also allowed to reopen, but must be closed by 10 p.m. Malls, including food courts, can now fully resume operations, while the public will be allowed to return to our beaches, rivers, amusement parks, and zoos, because they have been reopened. Gyms and team sports for adults can resume, but no spectators will be allowed at any games. Educational institutions will also be allowed to reopen for the purposes of examinations and for essential staff to conduct and prepare for these activities. However, please be reminded that the full reopening of schools and educational institutions, including preschools and daycare, will take place in September on a date to be determined by the Ministry of Education. As of today, maxis and taxis will operate at 100% capacity and inter-island transportation will return to normal. A maximum of 25 persons can now gather, but events such as funerals, weddings, christenings, or any such religious activities should follow the guidelines outlined by the Ministry of Health for religious institutions. Our borders remain closed except for the managed entry of persons. And I wish to remind you to wear a mask at all times. No mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its effort to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.